Gail Garvey, and I'm the Senior Principal Research Fellow at Menzies School of Health Research. So my area of research is around cancer and Aboriginal and Torres Strait Islander people. So I decided to become a researcher because Aboriginal and Torres Strait Islander health, as long as I've known it, has always had significantly poorer outcomes. And I have worked as a school teacher, trying to improve outcomes for our high school kids and mentoring and supporting Aboriginal and Torres Strait Islander high school students. And then I thought I could really do more, and so I started working at a university. And then in that position, I really wanted to focus about building a health workforce. So then I started doing research around health workforce, trying to ensure that we have, appropriate numbers of Aboriginal and Torres Strait Islander doctors, nurses, and allied health professionals. And then from that, I thought, well, I'd really like to just focus on one particular area. And so I'm focusing on cancer, and it's all about improving outcomes for Aboriginal and Torres Strait Islander people and a better future. So we were successful in receiving a Centre of Research Excellence in Cancer and Aboriginal and Torres Strait Islander people from the NHMRC. Cancer mortality rates for Aboriginal and Torres Strait Islander people over time, so over an 18-year period, have increased by 21%, but decreased for non-Indigenous people by 13%. So the gaps are increasing. Therefore, our CRE has been able to implement and develop research to help inform policy and practice to try and have an impact on those outcomes. And it's been fantastic because it's enabled us to coordinate and collaborate not only within our own research team, but with other researchers, community organisations, government and non-government organisations across Australia to have a coordinated approach to the research agenda to try and achieve the maximum outcome. We've been able to achieve significant outcomes in building capacity, which is a focus of the Centres of Research Excellence. So we've supported 12 PhD and master students to complete the postgraduate studies. 6 of those 12 are Aboriginal or Torres Strait Islander. So I think that's a fantastic outcome. We've also been able to support a number of postdoctoral research fellows, many of whom are also Aboriginal or Torres Strait Islander, and I guess supporting those postdocs was really important in the CRE because we wanted to build future leaders in cancer research. Advice that I would give is that, particularly for Centres of Research Excellence, is to be collaborative, to engage all of the key stakeholders, and don't forget about the end users, don't forget about the individual Aboriginal and Torres Strait Islander people out there and the community. So engage everyone in the process, in developing the grant, developing the research ideas, implementing right through to translation. And I'd also have a look closely at the Luicha Institute and some of the principles and the processes that they have, such as roundtables, for assisting them in putting together their application. In the future, I'd like to see more Aboriginal and Torres Strait Islander people as leaders of research and research applications and research grants. I'd like to see a greater impact and greater capacity building of Indigenous people to be leading and directing the work in this area.